Thanks very much, Paul, and good evening and welcome everybody on behalf of Purina to this talk. We've had such lovely feedback from everybody on these talks, and we're delighted to be able to help bring them to you, and with such great calibre of speakers such as Danille tonight. This is part of our commitment to the veterinary profession and practice, and we're looking forward this autumn to bringing you further talks. So we've got ones coming up on neurology, on diarrhoea, and more. So really looking forward to connecting with you on those. But without further ado, I will hand over to Paul and back to Danille, and enjoy.
Okay, I think it means it's come over to me. Well, it is wonderful to be here this evening. I am settled into my spare room. The cats have been evicted. They're outside with their daddy. If you hear squeaks and squalls, one of them is now quite demented. My apologies ahead of time. So tonight's talk, feline urinary tract disease, and we're going to concentrate on causes and management. So this is otherwise known as my pissy pussy talk. All my talks have cute names. Big thank you to Purina. Definitely, it's an important topic, such an important topic. So without their sponsorship, we wouldn't be able to have it. And also, always, massive thank you to the Webinar Vet for hosting these. I just love them. So you all know what this looks like. So plaquuria, increased frequency, periuria, I love that word. That means pissing around. So I accuse my final year students of doing that quite a lot. Hematuria, etc. You know the other causes. But I do also want to draw your attention to the little photo at the top. This is a cat who's got serious cystitis. Now, I know people who are into dermatology might go, oh, this cat's got fleas. Yeah, it could be, but this cat has got bad cystitis and she's got a painful bladder, and the pain is radiating down her legs and down her tail, and hence she's plucked her fur. So that's an important one to look out for. The clinical signs of FLUTD, which is just the umbrella term, which encompasses all the different reasons to have an inflamed bladder. So we'll go to individual causes in just a bit. Tends to be episodic in nature unless they block. And obviously then you've got to unblock them. And you can get altered behavior. Initially, the cats tend to get a little bit more friendly. Sometimes that is because they've got kind of perineal tingling, potentially interpreted as something quite pleasant, and that unfortunately then switches over to being pain, and they then get grumpy, not surprisingly. So they're the kind of clinical signs that we're thinking about. Make sure we're all on the same page. Certainly in Britain, it is incredibly common, and certainly in all the different countries where I've seen data, it's up to about 10%, between 1 and 10% of all the cases, cat cases that come into clinics. But I do think it's worth flagging this statistic up of cases that are referred for behavioural problems, where they've been referred for periuria, so inappropriate urination. Over 90% of those have had blood in their urine at some point, which really goes to show that the difference between stress cystitis, which I'm going to call idiopathic cystitis, which obviously that's crazy because we know what's causing it, and true behavioural, it's just completely all muddled up. It's all the same thing. And stress most certainly can cause bloody urine. Tend to be young to middle-aged cats. When you look at this graph below, you can see that the cats kind of peak between 4 and 7, while as dogs would just increase with age. So it shows you that the situation in the cat is really very different than the one in dogs. Persian cats and black and white domestic short hairs are predisposed. This is a fat black and white boy at the top. This is the absolute archetypal cat to get blocked. I really worry when I see fat black and white boys. If anyone wants to know the black and white theory, ask me at the end. Obviously, male and female are affected, but because the boys block, and that's life-threatening, you'll see far more of those in referral centres. So what about causes then? That's what we've got to start with. Okay, what causes this? And straight away, what you see is FIC, which, yeah, it stands for feline idiopathic cystitis. It's had a few other acronyms over the years, but that is what its current name is. And certainly 5-10 years ago, we weren't quite so sure about the role that stress is playing with this disease. Now we are much more aware. And yes, we don't know what the absolute primary trigger is that means that this particular cat, that when stressed shows bladder signs, whereas another cat when stressed, for example, might show gut signs. We don't know what makes an individual cat be bladder predisposed. So maybe there's a virus, maybe there's some kind of infection. We honestly don't know, but people have looked and not found it. So really, when I'm talking about idiopathic cystitis, I'm talking stress cystitis. And I think it's actually important that we really use that term, because it really helps our owners understand what we're talking about, because they don't understand what idiopathic means. Yes, it means we're idiots, we don't know what the pathology means, is what I was taught that it means. We don't know what pathology is. But our owners don't know that. If we call it stress cystitis, and make a point of saying, look at the numbers. Between 55 and 75% of all cats showing signs of bladder pain have got stress cystitis. So we should use that, and I think it'll really help owners understand just how important it is for us to correct that stress. About 20% are urethral plugs. And the thing about plugs is it's a combination of the protein that is just caused by, so look at the little middle image for you. So a plug is just the inflammatory cells and the inflammatory proteins that are being released from this horribly inflamed bladder wall. And then you add to that urethral spasm, which is because of pain. That particularly occurs at the level of the prostate, as you can see with the first arrow. My pointer's being silly. There you go. First arrow, and at the ischial arch. Yes, some cats do have a little bit of a narrowing there anyway, but it gets that much worse when you've got an associated spasm. Yeah, crystals can get stuck in it, but if you look at normal healthy cats on a normal dry diet, they will have a urine-specific gravity way, way, way above 1050. It will be 1070, 1080. And almost 100% of them on a normal healthy cat, normal dry diet, will have crystals in their urine. Now, they don't all block, which shows you the presence of the crystals per se doesn't mean anything. They're just getting stuck in the jelly that is the inflammatory debris that's getting stuck in the spasm. Now, obviously, the presence of crystals does show that you've got supersaturated pee, and that does increase your risk of uroliths. And uroliths, bladder stones, do form about 20% of cases. So we can't ignore them, but you can see that add these numbers together, and you've got stress cystitis actually causing over 75% of cats showing signs of cystitis. So I hope that really shows that's where we really need to focus. Urinary tract infection, less than 5% by the time cats are referred, a little higher in general practice, but often associated with stress cystitis anyway, because the urothelium isn't working properly. So if we then look at the difference between ages, there is a little bit of an age. Remember, older cats, it's unusual for them to present with signs of cystitis, but when they do, it is different. So if we look at cats older than 10, that's the maroony side. The lilac-y colour is exactly the same graph we were just looking at. But we can see that in cats older than 10, then a urinary tract infection is far more common. Now, clearly, cats don't get to their 10th birthday and suddenly go, oh, my bladder hurts. Of course they don't. Why are they getting urinary tract infections? That is because diseases of aging, particularly chronic kidney disease, hypothyroidism, and diabetes mellitus, all cause PUPD, which means the urine is less concentrated. And in the case of diabetes, there's also glucose in there to ferment. Also, all three of these conditions cause systemic immunosuppression. So it is not surprising that all of these conditions increase the risk of a urinary tract infection. What this means, if you've got a cat younger than 10, it's by far most likely to be stress cystitis. A cat older than 10, then you know what? It's likely to be a systemic disease, and we need to do more work to investigate to find out what that is. If we look at cases of obstructed FLUTD, well, look at the numbers. Okay, plugs make about, this is just stress cystitis, 60%. Pure spasm makes about 30%. So stress is actually causing 90% of the obstructions. Stones only make 10%. So this is really important, because now think about unblocking those cats, and you can see where your priorities have got to go. And we'll get to that, I promise. So we really need to focus on FIC. We know that really it is a case of a sensitive individual in a provocative environment. Great phrase, Tony Buffington coined it. You put that cat in a different environment, one that's less stressful, it'll be fine. Put a different cat in this environment, it might be able to cope. But this cat, this environment, bad news. Yes, genetics plays a role, but also it's developmental. What stressful thing happened to the kitten's mum at about the time of birth? What's a really good way of thinking it is a bladder migraine, because the disease is actually in the brain, and yet we see changes all the way down the spinal cord and into the bladder. So this is the whole system is affected. And the stresses we're looking at, these are chronic stresses, not acute in most cases. The one that comes out very frequently is inter-cat conflict. So living with a cat that you don't get on with, which if you think about it evolutionarily, that wouldn't happen. But we do see it occasionally in single households where they're really bonded to their owners, and we see separation anxiety. Moving house comes up time and time again, but then let's be honest, it's horrible for the humans, so it's not surprising the stress rolls over to our cats. Here's another cat looking stressed, or my husband says just looks like me first thing in the morning. So normal cats, they get stressed, they get activity in the hypothalamus, increased corticotrophic releasing factor. That acts on two places, on the brainstem and the anterior pituitary. I'm sorry, I know it's late. This is the only bit of heavy pathophys I'm going to do, I promise. So acts on the brainstem and on the locus ceruleus, which is the area in your brainstem that does vigilance. It also makes more noradrenaline than anywhere else. So this is upregulation of the sympathetic nervous system. But this also acts on the anterior pituitary, where you produce ACTH, which goes to the adrenal glands to make you produce cortisol. So this is activation of the hypothalamic pituitary adrenal axis, and we all remember that from college, don't we? Okay, it is a controlled, regulated stress response. It is the combination of adrenaline, or epinephrine, from the sympathetic nervous system, plus cortisol that allows us to do fight or flight. That's really important, because cortisol also turns off this cascade, and that's really important. Hold that thought, the need for cortisol to turn off the cascade, because what we see in FIC cats is masses of displacement activity. They are stress eaters. It's one of the reasons they get so fat. Massive upregulation of the sympathetic nervous system, but no plasma cortisol. And that is because their adrenal glands have shut down. The stress is too much. They've shut down, and the lack of cortisol means you can't shut down the sympathetic nervous system. So these cats are incredibly stressed, but they can no longer fight or flight. They only have freeze, and then the other F, faff and fiddle about, displacement activity. We will come back to that in a little summary slide in a minute. And as I said, the changes go all the way through the spinal cord down into the bladder. We have increased pain receptors, increased pain fibers, and we know that stimulation of these fibers, either through appreciation of stress in the cat's environment or local triggers from concentrated P in the bladder, you get release of substance P. And what these neuropeptides do is cause pain, vasodilation, increased vascular and bladder wall permeability. That's important. That is why these cats can pour blood so quickly, almost spontaneously sometimes, into their urine. It also means that they can leak the contents of their urine back into their body, which is not great. You get edema of the bladder wall and smooth muscle contraction, which can give you a small, hard bladder, but this also gives you the spasm of the urethra that we were talking about. It's so important. So this is neurogenic inflammation. We also know that the gag layer is altered in a lot of these cats. And that means if you haven't got the gag layer lining the bladder wall, that means that the concentrated urine, which is a pretty noxious substance, can diffuse straight into the urothelium to trigger more of those C fibers. So it's a combination. So I'm going to put that together in a pretty horrible graph. Ready for it? Well, not graph, but picture. So let's start at the top. Summary. Stress affecting the brain affects your brainstem and your anterior pituitary. You're going to get activation of the sympathetic nervous system, and through the adrenal cortex, production of cortisol. But with these guys, they don't get any cortisol. So it means instead of fight and flight, they can't do that, which means they show stress responses. They also show other systemic signs of stress. Tony Buffington coined the phrase, he wants to call this disease Pandora's syndrome. It's very pretty, but I think we should call it, I don't know, aberrant stress response syndrome, something that actually says what it does. And what we see in these cats is they also have more vomiting, GI problems, increased respiratory effort, increased respiratory disease, particularly stress will bring out feline herpes and feline calicivirus. So there's a lot going on in these poor cats. But interestingly, it's the bladder appears to be the biggest problem. So a couple of things I think it's worth kind of underlining with this. I've already mentioned that in general practice, we see more infection, more UTIs than we see in referral. What we do know, as I was mentioning, is that this urothelium is incredibly leaky. So it means that it can't actually repel bacteria very efficiently. So not surprisingly, they do get bacteria. So if ever you see what appears to be a bacterial UTI in a young middle-aged cat, be very suspicious that this is not a primary UTI. Be very suspicious that what you're actually dealing with is stress cystitis that's got a secondary UTI. Does that make sense? I hope so. What we do know is because this urothelium is so poor at fighting infections, whenever you catheterize these cats, they will get a UTI. 60% have got a UTI within 3 days. And where people have done perineal urothrotomies, which is rarely the right procedure for these cats, interestingly, same number again, do get 60% recurrent UTIs. But someone's done a pretty hideous experiment with normal healthy cats. They have done perineal urothrotomies on them. Guess what percent get recurrent UTIs? After all, male cats, they need that penis, don't they? They need that prepuce. Well, apparently not, because they don't get UTIs. They only get UTIs if they had FIC to start with. Interesting, hey? Another thing that we've shown is that chronic FIC can result in what we used to call transitional cell carcinoma, but is now called urothelial carcinoma. It can take a few years, and it tends to be the cats with a very thickened wall, as you're seeing in these images. And I'm just going to leave the thought with you. In humans with this disease, oxalate stones are actually part of the syndrome of presentation. So maybe the oxalate stones we're seeing are partly stress-induced as well. I shall leave that as a thought. Scary, hey? Don't stress cats. There's a moral there. What about stones? Well, certainly we know a few decades ago, struvites were the biggest player, and people found cats with urinary obstruction. They found the struvite crystals, and so it made sense to go, okay, well, let's modify diets so that we get less struvites, which we've done. They're far less common now, but we see a lot more oxalates, and we need to do more work as to working out why. What I will point out is that older cats tend to have oxalates, so that's an important one to look for. And really importantly, any cat that presents to you with a bladder stone and you find out that it's an oxalate, please, please, please check that cat's blood calcium, because about a third of them are going to be hypercalcemic. And it's hypercalcemia for lots of reasons. Sometimes it's idiopathic, very frustrating, but it can be vitamin D toxicity from licking psoriasis cream, or exposure to certain plants like the night-scented jasmine. It's got a vitamin D analog in it as well. But you can also see this with kidney disease. You can see it with some neoplasia, etc. So please look for high calcium, because high calcium can be eminently treatable. If you treat it, then you can stop the cat forming new oxalate stones, which has got to be. And I'm underlining that because we see so much big kidney, little kidney syndrome nowadays. This is bilateral ureteral stones. About 97, 98% are due to calcium-based stones, mostly calcium oxalate. So if you see a cat with a calcium bladder stone, please, please, please make sure you get radiographs or ultrasound so that you can see whether or not this cat's already forming stones in its kidneys, because that cat won't tell you when its first kidney gets a stone, its first ureter gets a stone. It'll just block. You'll get hydronephrosis. This kidney will get hyperplasia. The cat won't tell you a thing. It's only when the second ureter obstructs and you get hydronephrosis in this kidney, and this one's already atrophied and useless, now the cat tells you it's got a problem, and it's already quite late. So if you can identify your potential stone formers early, you keep a check on them with regular radiographs or ultrasounds. What we have, which is great, is this. This is the humane mousetrap. Great. So this is our CT machine. And you just put a cat in there, and it's also an oxygen box. This was my little Bengal cat. She was blind, which is why her eyes look so big. And the sort of images that you can get, this is cut through at kidney level. You can see one small kidney with a stone, one big kidney with big distended ureter, which you can then do ureteral stents or subcutaneous ureteral bypasses. That's not what this talk is about. I'm putting it there because if you diagnose oxalate stones in the bladder, please look for them elsewhere. I've already mentioned bacterial cystitis. It's mostly a thing of old cats because they've got chronic kidney disease, diabetes, or hypothyroidism. But you'll also see this with neoplasia and big time when we've got involved, so iatrogenic. I do want you to think about neoplasia. It's not common. I've seen quite a few urothelial carcinomas. They can either look like this one. So this used to be a TCC, or used to be called. Sometimes they're a nice big mass like that. More often they're very diffuse. I've also seen a few prostatic carcinomas which have presented as obstructed cats. So please look for those. That's a rectal exam to find those. Other things, polypoid cystitis, that is usually chronic inflammatory, chronic infectious. And then malakoplakia. We had our first case pretty recently. I did not even know what the word meant. This is a case of malakoplakia. My colleague Nick Bomber was the primary vet on this case. It's a chronic inflammatory response where the macrophages can't fight off the infection. If you see one, let me know. We kind of want to collect them. Occasionally we see incontinence, but this is nowhere near as common as in the dog. So common in the dog, it's boring. But in the cat, it's really unusual. It's usually due to chronic obstruction, which has resulted in then bladder atony and then overflow, or a spinal lesion. So when you see this occurring in older cats, be worried about a spinal lesion. So I hope that background, they're the causes. Yay! What's the biggie? It's stress. So given that the biggie is stress, we've really got to focus on the stress side. Okay, definitely. So I'm going to talk you through some tips for relieving obstruction, because I have done too many of these to want to not share it. And we're going to talk about how to manage the clinical signs of FIC as well. What I want to set the scene with is, if you don't do anything to change this cat's lifestyle, this cat is very likely to recur, to reblock, and ultimately be euthanized. If the owner really can engage and is able to change the cat's environment, diet, etc., then you can get really good recovery rates. In the MIMO study, which is Tony Buffington, he got an 85% recovery rate, and we're a little competitive. So I'm always very proud of the fact that in my study, I beat him. But you've really got to have dedicated owners. If you haven't, this is going to likely keep recurring. And once a cat has done it 2 or 3 times, it will keep recurring. If the owners cannot change the cat's environment and will not consider rehoming the cat to a less stressful environment, then offering euthanasia for the cat is not the wrong thing to do. I know it seems pretty radical, but think about the stress and the cost that this is going to put the cat through. Okay, the cost, not the cat, but you know what I mean. So there's my patent kitty stiffy picky. There's not too many people have one, let alone can say it. So first thing we do, I'm not going to talk about the really intense medical side. Basically, you want IV access and you want to resolve the hyperkalemia, the hypotassium. Best way to do that is give calcium, because 75% of these cats have got low calcium at this point, and it's that low calcium that makes the heart exquisitely sensitive to the hypotassium. So push calcium gluconate. Some people I know will just sedate the cat. They're fighting against nature doing that, because if you don't anesthetize the cat, then the urethral spasm will stay there, particularly if you're using ketamine as a sedative. So make life easy, anesthetize the cat. Then look at the penis for signs of trauma. You might be able to milk out that little plug, and then along will follow the pee. Sorted. At this point, what I want you to do is a rectal examination. And you're going, what? Unless your fingers are bigger than your average cat poo, which can get out of a cat's bottom, your fingers can get up a cat's bottom. The cat is going to be anesthetized after all. If this was a dog, you wouldn't think twice of it, would you? And what I want you to feel for is I want you to feel what's a normal urethra in other cases. And then, is there a stone? Is there a spasm? If you've got a really strong spasm, it actually feels like a really tight little piece of muscle. What would you do if you had cramp anywhere else? Yeah, you'd rub it. So do per-rectal urethral massage. Quite often, that's all you need to unblock these cats. So rectal exam first. I should actually change the order on this slide. I will do that next. At that point, if you can feel a stone, then you want to get ultrasound to see if you've got more stones in the bladder to try and work out what you're dealing with. If you can't feel stone, you could still do an ultrasound. That can be certainly very, very helpful. You're going to try to unblock this cat. The problem is, if that bladder has really built up some tension, then you are very unlikely to be able to relieve the pressure to pass a catheter without some kind of cystocentesis. What I will say is, don't do it like this. This is fine if you're just taking a cysto on a perfectly otherwise healthy cat, which is what Sarah's doing. But when you're doing this on a cat that's blocked, the urothelium is very fragile. It's under a lot of pressure. I can tell you, because I did it, 100% of these cats, when you do cystocentesis, will get a uroabdomen. Do I worry? No. What I do now is simply don't turn the ultrasound machine on. That way I don't get anxious about it. If they're not infected, it's going to be fine. It'll all get reabsorbed. What I do say, though, is don't use a syringe and needle direct like that. Use a syringe, three-way tap, and an extension lead, because that way the pressure, you get that hand tremor, it's not transferred to the bladder, and use the finest needle you can and empty the bladder as fully as possible. I hope that makes sense. Then you've got to pick a catheter. Depending where you are in the world, you're likely to have, so the little red top here, this is a fixed red top, and then this is otherwise known as a Jackson or Tomcat catheter. And if you look at the tip of it, it's made of hard plastic and it's got little holes. This is cheap, but you do not get long ones, and these are pretty traumatic. Please don't leave these in the cat. That is not good. The next cat is good for unblocking because it's so cheap. If the blockage is at the urethral tip, you could use an over-the-needle cath with the needle taken out. This is something called a slippery Sam. If you're in a country that has slippery Sam, fine for unblocking. That's the little herbert that goes into this very soft tub. What I would say is, do not ever leave this in situ. It doesn't say it on the packets, but it says it on the website. Don't leave them for more than 6 hours. And that is because the white bit will come apart from the black bit, and you will be doing surgery to get that black bit out of the cat's bladder. Yes, definitely suboptimal. So we then started using soft, easy-go catheters. No use for unblocking, and we used to put them in the freezer before placing them to make them a bit stiffer. They're good because they're a good length, but you then have to put the wings on to mark the length of the catheter. And if you put this little clip on to hold it there, it's too heavy and it will twist. You can put little sutures here, and that works, so you can make it the right length, which is good, because short catheters, these are just 10 centimeters, it's no use unless the cat's very little. But then this catheter came out. This was the original cat cath from Vigon Vet, and it was grey. And this bit swivels from this bit. They've now turned it into a black and orange one, black and red one. It's actually black and orange. The colour doesn't look great. It swivels. That is really good because it means you don't tangle up on your collection system. It's a Teflon catheter, which means it's very non-reactive, which is really good, with an open tip at the end. I like this. This is a 14 centimeter. This has now become my absolute standard catheter. I do the unblocking with it, and then I suture it in. Less cost, very effective. Really like this catheter. If you've got a really fat cat, though, a really big cat, then this might not be long enough. So Vigon also do an adjustable length catheter. And this is its little widget on the end, which you flip. And I think that's open and that's closed. And you can set that at any length, the same way as you can this EasyGo catheter. So you do need at least 14 centimeters. The end of the catheter has got to get into the bladder. There is no point leaving it in the proximal urethra. It's going to cause a lot of damage there, especially if you use one of these cheap ones. Use a smaller catheter, so a 3.5 is the best size that's been proven to use, not a 5. Okay, hopefully that's all good. Then look at cat's anatomy. There is a natural kink. It is at this natural kink at the ischial arch all catheter trauma occurs. All right. Here we've got the urethral catheter going into the colon, rectum, yummy. Here there's been a tear. Catheter is now in place, and here there's a horrible tear. That has occurred because the catheter has been put in and pushed. So it's pretty easy. Just look at the anatomy. What have you got to do to make that into a straight line? You hold the prepuce and you pull it up here so that it's a straight line from the tip of the penis into the bladder. So what do? We start with a rectal exam. Then an aseptic preparation. Remember, these cats have got exquisitely sensitive urothelia that's really going to get infected. Using sterile prep, evert the penis. Put the catheter into the tip of the penis, and in most cases you can do that. And then stop holding the penis because it bruises so easily, and you get hold of the prepuce and you pull that towards the tail and upwards. Straighten that line. Let's go back to it. Straighten this line, all right? Prepuce to tail. Then, if it won't pass to start with, do perrectal massage at the same time or flush some saline at the same time. Actually, both is really good. And then once I've got my catheter in, I do want to flush out all those inflammatory cytokines, bits of grit, etc., etc. There is a really good set of photographs with words on the Vigon website. They did a really good job on this. They contacted me and said, what would I want as the perfect catheter? I described it to them. I forgot to say I'd like some money. Damn. So I've never made a penny out of it, but you know what? I'm just happy we've got a decent catheter that I'm very happy to use. If you find a stone, then you need to do retrograde hydropulsion. So this, oopsie, again means one person's got to go per rectum. The way I find this works best, you put one finger per rectum and then get someone to place the urinary catheter into the cat's penis and then hold the catheter firmly. So prepuce around penis, around catheter, to hold that firmly and start injecting in saline. I actually find it easiest if I do the injecting in of saline so I can feel how much pressure I'm squirting in, and I've got my finger per rectum so I can feel the urethral column starting to dilate under my finger, because then I'm in control of both of them. And that way, as soon as I feel that column really building up, then I go now to myself, and at that point I raise the finger and give a good flush, and you'll feel the stone roll under your finger into the bladder where it can then be removed. Okay. That's the easiest way to do it. Obviously, you can do it any combination of one person doing per rectum and the other person doing the flushing bit. You've now got a catheter in, can do contrast studies, etc. By way of leaving a catheter in, this is an important one, because do you really need it? Let me just take a glug of water. Okay, so you've been thinking, do you really need it? Because if that went in really easily, and it really was just a spasm, and it wasn't even that bad a spasm because you got there quickly, do you need to put the cat through a stress of having a catheter in and a collection system and a bucket on its head? This is a stress-induced disease. Do we really want to do that? So where you were able to unblock really easily, then have a think about it. Could you keep the cat in overnight on lots of fluids, on prazosin or a similar drug, urethral relaxant, so that you can make sure it's peed in the morning and you can then send it home? Maybe keep it slightly sedated. Just a little bit to take the edge off. Maybe gabapentin, good as a take the edge off and for analgesia. Sounds good to me. However, if you are going to leave it in place, you need to make sure it is into the bladder so that it doesn't damage the proximal urethra, particularly if you're using one of those cheap catheters. In fact, please don't use those really cheap 10 centimeter catheters. They're just a disaster. And then you want to suture it in place, attach it to the tail, however you prefer, and then tape it to the top of the kennel, just in case you don't want the poor cat carrying all of this around on the weight of his tail or worse still, on his prep use. Keep going with the fluids and the post-obstructional diuresis potassium that he's going to need. And then how long you leave it in place. Initially, the urine is bloody. Once the urine stops being bloody, you should remove it. What we tend to do is all wait too long, don't we? Yeah, it goes bloody again. Then we go, I've got to take it out now. So I try to leave them in only a day, 2 days really max, unless I know there's been a tear. I do keep them on painkillers. This is painful. And I keep them on muscle relaxants. So prazosin, which is a smooth muscle relaxant, the dose being 0.5 to 1 milligram per cat every 8 to 12 hours. If I'm going high, which I usually am with these guys, at a mg per cat, and I'm going every 8 hours, I will check the cat's blood pressure to make sure I'm not going less than 100 systolic. If I'm above 100 systolic, I'm happy. Don't give antibiotics, but check the P when you're removing the catheter to see if you need antibiotics. I remember when this paper first came out, everyone was a bit shocked by it, and we didn't know whether we should share it with people. How arrogant is that? It's ridiculous that people actually worried about that. So I'm going to talk this through, remembering 90% of urethral spasm causes blockage. It is stress-related. It's a pretty scary protocol. They only do it where it's known recurrent spasm. So this is a recidivist cat. He's done it before. And there's limited biochemical changes. And it's where you want to avoid urethral catheterization, either for cost or because this is a very stressy cat. And they used a combination of ACP, buprenorphine, and medetomidine. Now, but clearly you could use different combinations. They did do decompressive cystocentesis, and they gave them some sub-Q fluid. They then left them in a calm, quiet, dark environment until they peed. Yeah, pretty scary. But they had success, spontaneous urination, in less than 72 hours in 11 of the 15 cases. Do I do this? Yeah, I do. Selected cases have been very, very successful. And for my cats that really do this a lot, I will actually have them have the selection of drugs they might need, that they can have them at home, so they can actually do it at home with supervision. The ones I've done that has actually been where the owners are medical in some degree. So I wanted to share that with you. It is something to consider, but you've got to pick your cases carefully. So we've now got our cats unblocked. We now have to think, in our last bit of our talk, long term, how do we keep them unblocked? Well, the first thing is urine concentration. We know that these cats have a median urine specific gravity of 1050, and that's simply because most refractometers stop at 1050, i.e. 1.050. Where I've looked with my digital refractometer, most of them are 1060, 1070. They are super concentrated. So we really want to increase fluid turnover, really make sure that the cats want to drink. offer them water in any way you can, dripping taps, water fountains. Most importantly, get them onto a wet food. Wet food is classically 90% water, whereas dry food is classically only 10% water, or those numbers thereabouts. So moist diet's always going to be better. And in the 2 studies that have managed to pull urine-specific gravity down below 1035, good success rates, really good success rates. But remember, go back to thinking about what this disease is. That means we're not showing clinical signs of cystitis, which means we've reduced the stress this little cat is on because he's no longer got cystitis, but he's still stressed. He is still unhappy with his environment. He's just coping with it a little better because he's not got raging cystitis at the same time. So doing this alone isn't enough. How can we do this? Well, 20 years ago, there wasn't anything to offer in diets, even 15 years ago. It was really a case of just trying to get them onto moist diets. But now we are so lucky. We have these 3 groups of diets. So you've got the Purina, UR STOX, the Hills CD Multicare, and it's got other things added too, and the Royal Canin SO. I've given you a selection of them here. But here's some data from Purina. And this is the specific gravities. So this is on a standard dry diet. The specific gravity of this cat, this particular cat, was 1057. Actually not that high for some of these guys. But this is old data. They've improved the diet a lot since then. This is probably data from, I'd say this is 10 years old now. Pulled it down to 1046, and on the wet version, 1043. And these diets have gone on from there. Are they physiological diets? No, I wouldn't say they are. Do they save lives? Absolutely. If you told me I couldn't have these diets anymore, I would be saying, well, you were condemning so many, probably hundreds of thousands of cats to death because we couldn't stop them having recurrent cystitis. Because what these diets do, they don't just treat the stress side of things by reducing the specific gravity and hence not having the pain of cystitis. They are also designed to actually start dissolving struvites and certainly preventing new struvites and new oxalates being formed. I'm not going to talk specifically anymore about the stone side of things, but that's what these diets are doing. So they actually do also, we don't have to have one for struvite stones, which I remember we used to have, and there are still some out there, and one for stopping struvites reforming, and one for stopping oxalates reforming, and another one to try and reduce the specific gravity. The very careful design of these diets means that they can do all of them. It's a busy slide, but we go over it at your leisure. So what we've got is the Purina diet, the Hills, and the Royal Canin. And what you'll see is they've all done different things to achieve the same kind of ends, very similar ends. They've added B6 that reduce oxalate formation. That's important. And then reducing the specific gravity of the urine. Hills have done that more with the potassium citrate down here, whereas Nestle, so Purina, have done it with added sodium, has Royal Canin. And it has been shown, initially there was concern that these cats were very high in sodium chloride, but they have now been studied at least up to 2 years and shown that that's not a problem, even in older cats. So do it in different ways. The important thing is if you've got a cat that won't eat one of these, and they come in different versions, different flavors. So here we've got dry, pouches, and tins. Tins come in different flavors, and you'll find that the same with the other companies as well. So you have choices. And with these cats, it's so important to have the choices because these cats are often very fixated on one particular diet. I like this study. This one happened to be done by Hills, but I'm hoping that Purina will be doing a similar one. Here they were using, say, CD Multicare, which is the same as urinary stress, but then they've added some things to potentially reduce stress. It was 1 year, double-blinded, placebo-controlled, all good. Cats had an option of wet or dry, good. Meant they could have what they preferred. This was acute FIC, so stress cystitis in single cat households, not the most common presentation, but it does occur. And what's really important is that these diets can so significantly reduce the incidence of recurrence of cystitis. Isn't that great? Let's at least take away the cystitis stress. We can then deal with everything else that's going on with these cats. Because to do that, we need to understand cat behavior. And it's important to remember cats are not truly social. We describe them as facultatively social. Certainly, they are solitary hunting animals. So they would eat on their own, and yet we expect so many cats to eat together. And they would only form social groups, which would actually be matriarchal groups. It would be a mum and a couple of daughters that would then look after each other's kittens when the other one went out hunting, that sort of thing. And so you only get groups forming where there are lots of key resources, and the big one seems to be food. Obviously, that goes down right back to their evolution in the Fertile Crescent, when we started growing grain and having grain stores, hence lots of mouses, and with lots of mouses, the cats moved in. So it is important to remember that cats do form bonds, can form bonds, but they're very fussy about it. So here we've got kind of two households. So we've got Tilly and Tammy are sisters, and they groom each other and love each other. And Fred and Millie are brother and sister. They love each other too. But then Bobby was brought in. Bobby really wants to be friendly with Fred. Fred doesn't want to know him, but he doesn't do anything negative to him. He just walks off. Millie would like to know Bobby. Sounds like a soap opera, doesn't it? Fred hates Tilly and Tammy because these guys were here before Tilly and Tammy moved in, and he thinks that garden is his. So when he sees either of those girls, he goes and attacks them. So that's the red line. That's the aggressive behavior. And Bobby, who wants in with Fred, will come and join in, particularly if they're chasing Tammy, who's the smallest cat. So it is important to understand the cat groups. So here, this is obviously one group in household A, whereas in household B, there are two groups. If you've got two groups, that means you need 3 sets of key resources. So people talk about litter boxes as in 1 per cat plus 1 extra. But, that isn't right. Actually, if you've got 2 really bonded cats, they'll share the litter box happily. In fact, well, one goes, the other one will join in. But when it comes to social groups, so it's per key resources, and these are your key resources: food, water, a latrine site, resting places. And food means feeding places, feeding stations, and then hiding places or places to escape. So I hope that makes sense. It's quick. I could do a whole lecture on this. I love a whole lecture on this, cat behavior and stuff. So when you're helping advise about cats like this, you have to ask the questions. It's a longer consult. You're going to have to give yourself time, which means you need to charge for it. Or if hopefully you've got a nurse who's really interested in cat behavior. One, they tend to be more patient than us, and it means they can take on dealing with this side, and then the cost won't be quite as much to the owner. So when we're looking at cat groups here, obviously these 2 cats here, they will happily go together. That's a group. And these guys, it's one group. You tend to find Orientals group up very easily. Whereas in this photo by Sarah Heath, now, there are 3 cats in this environment, and they clearly all hate each other. So you need 4 sets of resources there. And that doesn't mean, as I had a case last week, owners were so proud. Oh yes, they had 8 litter boxes because they knew that their 7 cats needed 1 each. They had them all in the downstairs bathroom, which meant that the one cat, effectively this cat, could just stand outside that bathroom door, sit there, and the other cats couldn't get in. Effectively, you had 1 big litter box. So that's really important. Overcrowding, you need to reduce numbers. I could do a whole lecture on urination stress, but enough to say, really think about it, how it's cleaned, etc. And because it's so difficult to do this advice, and it does take long, Sarah Caney and myself wrote this little book a few years ago, and you can get it from her website. I think it's about £10, $10, something like that. It's not expensive. It's designed for vets, nurses, clued up owners. It's designed really for high intensity owners is what we designed it for. And it's got all this information that you need to give this advice. I also direct you to the Indoor Pet Initiative, because if these cats are indoor cats, they need enrichment. Any diet changes need to be done gently. Owner stress. I'm going to take a second here. One, because I've been speaking very fast. And I did a study where I was looking at 40 cats with stress cystitis. And I asked all the owners about stress in the home for me to try and get a handle on what the cats might be dealing with. 39 of those owners volunteered spontaneously that they were either on SSRIs, so serotonin reuptake inhibitors, or TCAs, tricyclic antidepressants, themselves. And certainly the 40th most certainly should have been. She was hard work. So the more I've looked into this, and this comes out in some of the papers published as well by Tony Buffington, owner stress and an inappropriate cat-owner dynamic underlies a lot of these cases. It tends to be where the owner wants it, oh, little squidgy kitten, I want to give you kisses and huggies, and blah, blah. They want to do that the whole time, and the cat's going, bugger off, this is horrible. So it's that mismatch. So we need to gently find that out when we interview the owners as well. Other things that can help, the pheromones, we've got the classic Feliway Classic, that's an anti-stress, and then we've got Feliway Friends, that is where you've got cat-on-cat dynamic that's not working, or you're introducing a new cat. Another plug-in is Pet Remedy. This is supposed to be an anxiolytic. There's only actually published data on Feliway at the moment. The milk protein hydrolysate, the classic we think of as Zilkine in this country. I know it's available in other countries too. There are at least half a dozen or more papers on that showing it's pretty good at reducing stress in a number of different species, including people, dogs, rats, and cats. So certainly something to consider. And that product has effectively been added into.
I'm sorry about this, everyone. We seem to have lost Danielle. So what we're going to do is give her a quick call now, just see if we can get her back online, because it seems that the internet has gone for her.
Come on. What's the matter with you? Right. Okay. Are we back, guys?
That looks good to me.
Yay. Okay. Seriously, 2 webinars go down, and I'm just doing my heart in. Going to have very large whiskey after this. Okay, well, I'm really, really sorry, everybody. I have no idea why that one was. That's my laptop playing up, I think, and it was a desktop at work. So to continue, wherever we got to, I think we were talking about milk protein hydrolysates, weren't we? And the fact that there is some pretty good data on the use of Zilkine. So definitely something to consider. If the cat has outdoor access, or even if it doesn't have outdoor access but can see outside, then be aware of the stress that can be caused by it seeing cats outside that kind of sit on a high wall and glare in at it, particularly if it can see them from wherever its litter box is. And if it does go outside, you can see this little guy having to pee in the snow, doesn't look very happy. And we know that stress cystitis is pretty seasonal. Do never start a study to recruit these cases in the summer, because you see very few. And then MIMO. MIMO stands for Multimodal Environmental Modification. This is Tony Buffington's study. This is detailed questionnaires with the owner. So you have to determine how many groups of cats, and then you need to look at your stations for each of them. And then you're looking at educating the client about what the groups mean, what they need to supply. Our little book can be very useful here. Also Tony Buffington's website, which is the Indoor Cat Initiative. And if you do all of these things, then you can get 95% recovery and these cats stay good. So you can really resolve this condition. But if you don't do that, recurrence is going to happen. Because the problem is we don't have a golden bullet. If you look at the treatment of this condition in humans, which is called interstitial cystitis, they have tried so many interventions, but actually things that have got some degree of pooled estimate of benefit. Relative risk of a 1-to-1 means the same as nothing. Okay, so none of them are very positive, but we can see some slight positive effect to the use of pentastan polysulfate, which is a gag, tricyclic antidepressant, which is amitriptyline, hydrazine, or hydroxyzine, I never say that right, which is antihistamine, potentially here, cyclosporin. We're not going to go there, are we? I'm going to summarize the gag studies They're all there, so you can look through them. They make no statistically significant difference. To be honest, they don't make any clinically significant difference. Okay, so in this study, it was a short study, potentially a little bit of a change in hematuria, but there really wasn't. It wasn't significant. This is using oral N-acetyl glucosamine. This is a gag. Using pentastan polysulfate, this is a 6-month study, 1-year study, no difference. Using pentastan polysulfate in the bladder, no difference. And then mix it with a whole load of other stuff. This is ACYST. Initially, it looked a little bit good, but then no statistical difference. So it might help in certain cats. It may be, as in people, it seems to be that certain gags in certain people at certain times may be of benefit. But these are expensive. Water is pretty cheap. So which way am I going to go? I know that getting the urine specific gravity down to 1035 is almost guaranteed to get these cats not having signs of cystitis, whereas all of these drugs are pretty expensive and they really don't work. What about spasmolytics? Here the data is much better, particularly prazosin. That's where most of the good data comes from, and I've already mentioned it. This can be used immediately after unblocking cats. It can also be used for cats that have spasm regularly. They can either stay on it for life. I have had cats on it up to 8 years. Not really what I wanted to do, but every time we stopped, he blocked. More typically, I give the cats a 2-week course of this from the point where they block. So after they've then left the clinic, and that keeps them covered for the first week, 10 days. And they keep some more at home, so if they start showing signs of reblocking, they've got some there to give. For skeletal muscle, dantrolene tends to be what we use. The data's not so good on it, and it's pretty expensive. Certainly if you go IV, it's very expensive. Interestingly, amitriptyline, it wants to jump ahead, amitriptyline actually can be a pretty good smooth muscle relaxant. It's certainly got lots of other effects as well. Just look at the list of what this does. But, pretty impressive side effects. The obesity and the somnolence simply means you've got a cushion that occasionally shits and pees. It's not a pet anymore, let alone the liver failure. And in 2 studies, short courses of amitriptyline showed these cases got worse when you stopped. And only in 1 case, which was an open label and the cats were going to get euthanized if this didn't work, then in those cases, some of those cases appeared to improve. So if you're going to use this, it's got to be long-term. I will actually use it where I know there's going to be a pretty hideous stress that can't be avoided, moving house, going into a cattery. And I will put them on starting before the stress and then for a little while after the stress. SSRIs like fluoxetine, there's no studies, but again, I have the same concerns. It's one thing for us to live a stressful lifestyle that results in us needing to take antidepressants, but we know that these cats get better if we rehome them to a house that doesn't have other cats in and that isn't stressful. We have done that experiment repeatedly, and they don't block again unless the ex-owner comes back to visit. So can we really justify having our cats long-term on these drugs when we could change their environment and sort it out for them? So what about other drugs? Well, non-steroidals, certainly it's painful, so analgesia is going to help. I think what I want to add after NSAIDs there now very much is gabapentane, because we're using that as a painkiller much, much more, and it does have mild anxiolytic effects without all the other side effects. So I think that might be something to consider. I'd love to see studies on it. There are none yet. It's been used for things like osteoarthritis pain and visiting to the clinic, anti-anxiety, but not for this yet. Watch this space. Hydroxyzine, I can't say it, has been tried. It was non-effective. Oxybutynin has been tried, not effective. Corticosteroids, not effective. Intravesicular lidocaine, not effective. Antibiotics, not effective, although they did use chloramphenicol, which was an odd choice. And we have talked about the fact these cats are at risk of getting secondary infections. I like the idea of meropenem because it's an NK1 antagonist. It's also a visceral analgesic, so you know what? take the pain out. Yes, please. And this works on mast cells, and mast cells play a significant role in these cats. So I'm waiting for that paper, and I must admit I have used it on a few cats, which are my bladder cats, on the grounds I want a visceral analgesic in literally ends of 1s and 2s and 3s, i.e. less than 6. They all did well, but we need a proper study. So the important thing, management can only be palliative. We don't have a golden bullet. We don't have a way of curing this. There is no point sending them out with truckloads of gag supplements. It's not going to make a difference. So what can we do? What do we know works? We know MeMO works. We know reducing the urine-specific gravity works, which is part of MeMO. Reducing stress works, part of MeMO. And getting them onto the appropriate, ideally wet diet. If I really want them to take wet food. If they won't, if they will only take dry, then please, please, please make sure that it's one of these diets, that it is designed like the Purina diets to reduce the specific gravity, to reduce further oxalate formation, reduce further struvite formation. It makes a huge difference. Then what I'm going to be thinking of, I do use antispasmodics. I use antispasmodics a lot, actually. All my cats that block go onto it unless there's an absolute reason why they can't. They've got concurrent heart failure, for example. And I do send owners home with a packet of it for emergency times, including the females that get spasmy. It can help those. I don't think gags work. We may find at some point certain gags in certain cats, but we can't get that yet. I don't use tricyclics unless it's those chronic stress situations where I know the stress is going to come to an end, like moving house. Monitor closely. I'm going to come back to that on the next slide. If not, rehome. I know it sounds terrible. Owners are always horrified. Nobody loves little Fluffy more than I do. And they truly believe it. The problem is they want a relationship with this cat that this cat doesn't want. So I always introduce this to the owner as respite, that the relationship between them and the cat has become very, very stressed. And is there somebody in their family or a friend who doesn't have any cats, preferably doesn't have children or dogs either, but is a very mellow kind of person who would allow the cat to come and stay for a couple of weeks? And what happens is the cat spends 1 to 2 days hiding under the sofa or the bed. Then it comes out, notices that nobody's used the litter box in that time, happily uses the litter box and never looks back. That is, unless the owner's sister comes to visit, who was the original owner, and then just the sound of the ex-owner's voice is enough to make the cat pee blood again. Unfortunately, I've done that experiment too. So by way of close monitoring, this has to be a relationship between you, preferably one of your nursing team as well. I think we've probably got some nurses, technicians here tonight. I really hope so. It is such an important topic, and you guys, it's a teamwork, and we need people who can be really patient with the owners, and that is so important. So we want the owners to note when the cat's going in and out of the litter box more. The owner said, she could tell when he was going to reblock because he played the fiddle more. Took me ages to work out she meant this was playing the fiddle. The cat started over-grooming her tummy more. These guys, they started scrapping when normally they were best mates. And say, this little book really can be very useful. And to show that I'm not biased, again, I received no money for this. I helped write it as a gift to Sarah when she was starting up her business. So I hope that has been useful for you. It's a topic that's so close to my heart. I regularly do bladder sessions that are 3 and 4 hours long. You can probably tell by the time I've thrown in cases and diagnostics, I just love it. But today, I've given you the absolute nuggets. I hope they were useful wherever you are. Huge thank you to the Webinar Vet for putting on this webinar, and really to Purina for funding it, because with their support, it means it can go out. I understand it's going out to about 3,500 people, which is great. So apologies again for the computer glitch. When computers work, it's fabulous. I can sit here in my spare room and talk to you in Bondi. But when it goes down, it's a little bit frustrating, definitely for you guys, and definitely a bit for the organisers as well. So with that, I will happily take some questions. Thank you.
Thank you so much, Danielle. That really was an absolute pleasure, as always. And there are many, many questions coming in. Fascinating to see where everyone's listening in from earlier. We had people as far away as the west coast of America, Burkina Faso, Australia at 4 a.m. Someone was listening in.
They're crazy. No, they've got a cat with FIC.
Quite possibly. So let's try to get through some questions. Many of them coming in. You mentioned about VNs being on. Lucy said she's currently studying the DRPA VN in the UK. Do you have any good studies or any information as she's using FLUTD as my applied nat and phys assignment?
I don't quite understand the question. I'm sorry.
What do you have any articles or papers that you'd recommend that would be good to use?
Hundreds of them.
Where would be good to look?
Yeah, probably the easiest, to be honest, if you don't have web access, then the little book is a good place to start, but there's just so many. If you email me, I can send you my bulk notes. I've got long notes, and at the bottom of it, if you email me references FLUTD, and then it's got about 4 pages of references at the end, and then you can highlight the ones that you can then see which are going to be the most sensible ones to chase down. That's probably the easiest way of doing it for you.
That's great. Thank you very much, Danielle. So I have a question here from Maria. Is there any well-known interaction between zilkine and L-theanine for treating FIC and anxiety?
No, there's nothing published, at least yet. Certainly, or not that I know of. And if someone's got something, please send it to me. I can't keep on top of everything. And you guys come from such a diverse background. I always want to know your tips and tricks as well. You know, we all gain from these interactions. Certainly, the zilkine studies, some of them are pretty old because the drug's been around for a long time, which also, so I've got hiccups, which also tells you it's very safe, which is great. It binds to the same receptors as diazepam, but in a non-addictive way. And certainly L-carnitine, you know, there's more studies coming through that does seem to have a calming effect. It makes sense to put them together. And certainly, if anyone's done the combined studies, it will be the food companies that have combined them. It's Hills who've got the combined out, although the Waltham one has certainly, it's got the Calm has got. I would go to those two. I think it'd be really interesting. You could do freedom of information and ask them for what studies they've got on the efficacy of the protein hydrolysate with the tyrosine. And then when you get an answer, would you send it to me? Because then I can put it in my next talk, which would be really good. Thank you.
Yes, please do send anything like that in. That'll be excellent, and we'll try to add it to the site as well, so it's there and available to everyone. A few questions about catheterization. The first question, should we use antibiotics, or should we always use antibiotics if the catheter needs to stay in for 3 to 4 days?
Nope. My slide, go back to that slide. It says no antibiotics. So absolutely not. Please do not use antibiotics unless the cat is actually spiking a fever, or the cat has got some other horrible trauma that means it must have antibiotics. So, for example, if it's a car accident that its whole perineum is torn up, so it's got to have antibiotics, then you have to. But go for the least effective antibiotic. That sounds really weird, doesn't it? Go for amoxicillin, so that you've got somewhere to go when you get a resistant UTI. Because, as I said, 60% are going to have a UTI within 3 days. And we really don't want that to happen because the risk of it getting resistant is very high. So hold off on the antibiotics, hold your nerve, unless the cat's got a fever or it's got other serious damage. Please don't start the antibiotics until you've taken the catheter out. And then when you take the catheter out, you could presumptively start with something like amoxicillin, wait for the culture to see whether or not you need to change to something more specific. Does that make sense? Hope it does.
Thank you. Very important information there, and better to have it twice then, I guess.
Oh no, I completely agree. If one person has misunderstood, I do speak fast. So if one person has misunderstood, other people will have. So no, I want you to ask those questions because it means I can reiterate such an important point. So thank you.
Excellent, thank you. Trini's asking, do you always recommend using closed systems?
I do. In practice, a long, long time ago, we didn't because we couldn't afford them. But what you can use, the risk of a UTI becomes everybody's going to get a UTI. And the problem is it can then go up to the kidneys, and before you know it, you've got bilateral pyelonephritis and you're not going to win. So please use a closed system. If you can't afford to buy the clean ones, sterile ones, then use an empty drip bag, but which we always used to do, but please label it very clearly that this is a urine collection system, because I was using one when I was still in as a resident, and one of my very keen students thought, oh, that's odd, the drip bag's fallen down, and they lifted it up and hung it up. So the poor cat, by the morning was going, what the hell, I need a pee, because his pee was just all going into him rather than the other way around. So label it clearly as urine only.
Oh dear, not envious of that cat.
Or the student in the morning.
I can imagine. Lots of other questions coming in here, so please do keep them coming in. Thank you very much, guys. Many people asking about the black and white cat theory.
Oh, I thought you might. Okay, so anybody who... this is my pet theory, okay? It could be complete Rollocks. But if anyone knows the work done turn of the century before last on silver foxes, these were when stupid women wore fur coats. You're right, some stupid women still wear real fur coats, but we can kick them, or at least threaten to. And so because these silver foxes came from Russia, people had to go out and shoot them, and it wasn't much of a fun life. So they decided to trap them and make them breed together. The problem was they kept throwing themselves at the wire and trashing their pelts. So they didn't actively select. They simply let the cats, the silver foxes breed that were the least reactive, the ones that sat there and didn't throw themselves around. And silver foxes have got pointy noses, pointy ears, this plush blacky silver coat, and they don't make a noise. Within 13 generations, they had got floppy ears, a round muzzle, they yipped all the time, and they'd gone black and white. So if you think about it, melanin comes from the neural crest originally. And so to do with, so much of your brain development actually is reflected in the color of your coat. Same way as red-headed animals have got more blood vessel reactivity. Black and white cats and a lot of other species quite often have this ability to cope with stress by internalizing it. So they end up with shrunken adrenals, the same way as the silver foxes had. The cats with FIC also have shrunken adrenals. So all the same changes that are seen in the silver foxes are seen in the FIC cats. There's more work to do, but it's a great theory, and you can shoot me for it. Find me a new theory.
That is very, very interesting. I'm glad everyone asked that now, because that's fascinating stuff, really. I have comments here from Hannah saying, having worked in a shelter as well as private hospitals and seeing referral behaviour cases, alprazolam works really well for shy cats, for example, if you are rehoming them rather than hiding them for a few days in the new home. And they could have a day or two of alprazolam and won't even go through the trauma in the short term. And,
I think we need more of these kind of data to come out, because it makes such a difference if we can get through the initial stress. And so that's why I suggested gabapentin. We don't have any studies on it yet, but we know it's being used in shelters, particularly as if you've got access to the Bova reformulated drugs. There's a chicken-flavored liquid, which seems to be very palatable for cats. And there's a lovely study where they used gabapentin liquid in trapped new-to-return cats, and the cats showed far, far fewer signs of stress. So I think Hannah is absolutely right. We need to find drugs that have ideally a temporary effect to reduce the stress, particularly in this kind of situation where you've got rehoming, that sort of thing. Things that are better than tricyclic antidepressants, things that don't actually affect the cat in anywhere near so much, but reduce its stress. Completely agree with you. Thank you, Hannah.
Yeah, that's great. And Hannah's actually mentioned that she's a clinical animal behaviourist. I'll put my teeth in again.
I thought she might be. She sounds like somebody who really cares about cat behaviour, which is brilliant.
Yeah, and she said she'd also recommend working closely with a referral behaviourist, which I will add the link into the chat box now, that you can go and search for one if you so wish.
She's absolutely right, because if you haven't got someone in your practice who is focused on that, then this isn't stuff you can learn in a day. And the people who are trained in clinical behaviour, they really understand this really well and can really talk to owners much better than an awful lot of us vets who we're too medical, and we need to take it back to the cat and the owner's relationship. You're absolutely right. Thank you.
That's great. And Hannah said, actually, you taught her in Edinburgh too as well. So
I thought she sounded like one of mine. Good on you.
There you are. So a couple of people asking about gabapentin as well, dosage, how long you'd use it for, etc.
Well, so we don't have any studies on FIC, but I am using it much, much more, particularly with my old souls. I do a lot of work with geriatric cats for arthritis, etc. Starting dose is 5 milligrams per kilo. I often, if they are very arthritic, I start with less than that, because they're sometimes a little ataxic for a day or so. So if they're very arthritic, then start lower so they don't fall when they're wobbly. But standardly, you'd start 5 mg per kg of an evening for a couple of days to get over that wobbly phase. And then quite often 5 mg per kg is enough. It often isn't for cats that are in quite significant pain. They've got pretty bad osteoarthritis. The most I've got up to is about, I think I've got one cat on 25 mg per kg twice a day. It's unusual to need twice a day, usually once a day, and you aim to get to 10 to 20 mg per kg. But some cats you'll do fine on 5 mg per kg, so definitely worth considering. And where we're treating for coming into a clinic, so if we've got a very stressed cat at a referral practice, or the clinical general practice, and they're referring it to us, and we know it's a very stressed cat, then we are having them give 50 to 100 milligrams total to the cat. We try to get the owner to test it, so maybe 2 or so hours before travel, give 50 milligrams, see how wobbly the cat is, see how sedated the cat is. If the cat looks just like the edge is off, looks quite comfy, perfect. Then they come and drive down to see us, because they often long drives to get to us, and it just means the cat doesn't arrive covered in pee, poo and saliva, and which so many of the stressed cats do, because the whole thing, they've never been in cars, etc. So I'm really liking gabapentin in that situation as well.
Excellent, thank you very much. I have a couple of questions here about blocked and obstructed cats. I'm conscious we are pushing on for time. We're well past the scheduled finish time, so we'll take a couple more, and then any other questions that the community has, if you email them into us, and we'll be able to get some answers back to you once the recording's up on the site as well. So Rodolfo's asked, he said, thank you very much for this brilliant webinar. Several vets use diazepam as a striated muscle relaxant. What do you think about it in obstructed cats?
If you're using it IV, I'm less worried. My big problem is we know that per os, it has caused rather a lot of cats to go into fulminant liver failure. It was behavioural cases that this occurred to. It was the oral formulation. So if you're using IV, I'm less worried, and certainly it can help, and it's a lot cheaper than dantrolene. I would prefer to use midazolam, because that hasn't been shown to have the same problem. If you are using it longer term per os, I really worry about the liver problem. If you need striated as well, and to be honest, the mix and match of those nerve endings, they don't do it as neatly as the pictures, shall we say. Often prazosin is plenty. I used to do prazosin and dantrolene, but it's harder for owners to get it into the cat, etc., etc. So I switched to higher doses of prazosin And I've worked out, for my cats, that seems to work as well as using both at the lower doses. But if you do need oral dantrolene, that's now being reformulated by some of the reformulation pharmacies as well, which will make it easier for you. And it's a good skeletal muscle relaxer.
Excellent. Thank you very much for that information. So just the final questions then. So Emily said, hi Danielle, thanks for another fab webinar. What formulation and dose of calcium would you supplement IV to combat hyperkalemia in blocked cats? And Peter's asked, would you give calcium or kalium?
Oh, I've never heard of kalium. That's new to me. To be honest, my block cats now, I happily, that when the electrolytes are a complete mess, I send them to the ICU. But the reason I like the calcium is it was really easy to do. You take calcium gluconate 10%, you mix it 50-50, or it's a mil per kilo of cat. So a mil per kilo of cat of 10% calcium gluconate, mix it 50-50 with saline. There you go. And it was maths that I could do in the middle of the night when my brain wasn't working, which was my reason for thinking that was a good thing. Other people were doing fancy things with insulin and glucose and stuff, which you then chasing, because the blood glucose goes too low, and then, and we now know that actually it is that combination of the low calcium with the high potassium that causes these hearts to get into such a pickle. So give them the calcium, moderately quickly. Too quickly and you'll mess the heart up too, but I give it moderately quickly. It gives you 20 minutes, and you can normally unblock a cat in 20 minutes if you remember to just pull that prepuce nice and long and straight and do all the rectal stuff with your finger. The most important thing you need to unblock a cat is one human finger wrapped in plastic and covered with lube.
Brilliant practical advice as ever, Danielle. Thank you so much. Thank you everyone for joining us tonight. It's been a fantastic webinar. Thank you so much to Purina as well, whose kind sponsorship has made this free for everyone. If you do have any questions, as I mentioned, email them into office@thewebinarvet.com, and we'll try to collate them and provide some answers in the coming days. And thank you so much, Danielle, for another brilliant webinar.
You're very welcome. Thank you so much for organising it, and definitely thank you to Purina for making this so open. But my biggest thank you, as always, goes to all of you guys all over the world, taking your time. You could be doing so many other things, and yet you want to share it with me talking about cat medicine. And for that, I will be eternally grateful. Thank you.